Hello from Jonathan and me, and welcome to the programme.
Well, first tonight, as shops enjoy record Halloween sales of a staggering £250 million, police across our region say they're determined to make sure tomorrow stays a night of fun and not fear.
Yes, as youngsters get ready to go trick-or-treating, many places have already stopped selling eggs and flour to under 18s, and officers say that anyone caught causing trouble will be severely dealt with.
Well, Emma Baker's been looking at the booming Halloween trade. Joins us now from Lenwade in Norfolk. Emma, you fit in well there by the looks of it. Looks as if you're having a good time as well, but it might not be the case everywhere.
Yes, good evening. Welcome to the Dinosaur Adventure. This, of course, is one of many events that's organised across our region over the Halloween weekend, which is one of the biggest party weekends of the year. Now, of course, this has been well organised. You can see the kids behind me have got their costumes on. They're looking forward to some spooky and harmless fun. But, of course, we're being reminded today that is not the case across the region. There really are two sides to Halloween. For some people, this can be one of the most frightening dates in the calendar for all the wrong reasons. It's a simple message with a serious point. Think of others this Halloween. Essex Police is just one force in our region working hard to make sure this weekend is fun for all.
If you're in that small element that wants to throw eggs and flour, then my advice to you would be don't, because anyone caught acting in an antisocial way will be dealt with by police officers.
As thousands gear up for a weekend of parties and celebration, there are some who fear what's in store. In particular, trick-or-treating.
3 years ago, we've had a high numbers of calls in Great Yarmouth area, but over the last 2 years, these numbers have dropped dramatically, and this has been through a problem-solving, but also visible policing on the streets.
This year, one shop in Lexden near Colchester is taking a tough stance against those who may want to cause trouble, as is this supermarket in Norwich.
All our checkouts actually have a screensaver on them, which before every transaction asks the cashier before they start to check that they're not selling eggs and flowers to minors.
Some shoppers we spoke to today were preparing for some trick-or-treating fun tomorrow, although many agreed it was important to act responsibly.
That worries me, because I live on my own.
Let the kids have some fun. As long as the adults are there, they'll be fine.
If there's elderly people on their own, that people at the door, they're not too sure what's going to happen, and not being funny, it's not particularly good for them.
Of course, the vast majority are just looking forward to dressing up and having fun. Dressing up for Halloween dates back to the Celtic times, but of course trick-or-treating is a much more recent tradition. It first began in the US in the 40s, but it wasn't until the 80s that it came over to the UK. Since then, it's become an increasingly popular part of our calendar. This year, we're expected to spend £250 million on Halloween. That's 22% up from last year and double what it was 4 years ago. And that means big business. For supermarkets, this weekend is the third largest of the year, topped only by Christmas and Easter. Tesco alone is expected to sell 1 million costumes, along with 1.1 million pumpkins. All ahead of what could well be the biggest Halloween on record. Well, these little ones here are soon going off for one of their spooky Halloween walks here at the Dinosaur Adventure. What bit do you most like about Halloween?
I like the trick-or-treat.
Trick-or-treating. You've got a fantastic outfit there. Did you buy that today?
Yeah.
Beautiful, lovely. And how much are you looking forward to Halloween tomorrow?
A lot.
And what do you most like about Halloween this time of year?
It's scary.
It's certainly scary, and so is your outfit, looking very good there. Well, of course, like I said, these are about to go off for a spooky walk, but the message is consider others, think about those around us, and let's try and make this a celebration to remember rather than a date to forget.
Emma, thanks a lot. Enjoy the party. Now, next tonight, a train driver has told an inquest that he didn't see a car stuck on a level crossing just before a fatal accident.
Moira Cooney was killed when her car was knocked into the path of the train at South Drove near Spalding in early January. Jurors returned a verdict of accidental death. Matthew Hudson has this report.
Train driver Stephen Bosworth at today's inquest. He was driving the two-carriage Sprinter which crashed into the car stranded on a level crossing last January. Car driver Moira Cooney died instantly from massive head and chest injuries. The crash happened here at South Drove near Spalding in very icy conditions. Miss Cooney's Rover car had clipped a van containing workmen William Creek and Richard Dawson. The impact left her vehicle on the railway crossing just before the barriers came down. Eyewitness Maria Grief told the inquest she saw Miss Cooney frantically trying to drive her car off the crossing, but was unable to do so because of the ice. Family and friends of the victim were also at court. They believe that on such a straight stretch of line, Mr. Bosworth should have seen the car and braked if he'd been concentrating properly. But British Transport Police say they thoroughly investigated the case and found no reason for charges.
We downloaded all sorts of technical data from both the train. It has a black box like an aircraft. At the same time, we downloaded equipment from the line side, from the level crossing itself. All that data was looked at and basically clarified really what the train driver was saying, and that is that he was complying with the way he was taught to drive the train.
After 40 minutes of deliberations, the jury returned a verdict of accidental death. Miss Cooney's family left without commenting, as did Mr. Bosworth. Matthew Hudson, Anglia News at Spalding Magistrates Court.
A baby from Essex who died after being given an overdose of glucose was the victim of a tragic accident. An inquest in London was told today how Poppy Davis was transferred to Great Ormond Street Hospital after being born 3 months early in Basildon. The nurse looking after her was Rebecca Tite, seen here in the middle. She was in training and failed to set up the equipment properly, which caused a free flow of glucose to enter the baby's bloodstream, causing multiple organ failure.
The number of suspected cases of swine flu in our region has risen by 3,000 in the past week. 62 people are being treated in hospital, 15 of them in a critical condition.
It comes as more frontline health workers are immunised and stockpiles of the vaccine begin to arrive at surgeries. Victoria Webb reports.
So if you press down on that for me, please.
They're the people we need to stay well so they can look after us. Doctors, nurses and other frontline staff at Ipswich Hospital have been queuing up today to be vaccinated against swine flu.
Working both in the hospital and in the community, and because I've got my own family, felt it was important to come and get vaccinated.
Despite reports of NHS staff being reluctant to get immunised, the uptake here since the vaccine arrived on Tuesday has been encouraging. Here at Ipswich Hospital, just over 100 members of staff a day have received the vaccine. It will be 3 to 4 weeks, though, before all our GP surgeries receive their supplies. In some places, the vaccine has already arrived. These are NHS Norfolk's stocks, and they'll soon be distributed to clinics across the county. With 15 people in our part of the world in a critical condition from swine flu, health officials are stressing the importance of being vaccinated.
We are rolling this out to all frontline staff across the Trust. Approximately 2,000 to 3,000 people will be invited, and we're encouraging our staff to have the vaccination.
Back in July, after the World Health Organization declared a global flu pandemic, 18,586 people from across the east of England were prescribed Tamiflu after reporting symptoms. During the summer holidays, the number of suspected cases began to fall. But with the new school term and the cooler weather, requests for antivirals is on the increase again. Last week, 4,815 courses were collected, and that's risen to 7,380 in 7 days.
Their GP will be contacting them, and they'll contact them in order of priority. So there are some key priority groups, mainly based around the same sort of priority groups as seasonal flu, but also pregnant women, immunocompromised people and the people that live with those people.
While the effects of swine flu are mild in the majority of people, there is concern by the rising number of patients being treated in hospital. As we enter the second wave of the virus, the key message once again is to maintain good hygiene to prevent the virus spreading further. Victoria Webb, Anglia News, Ipswich.
Well, do stay with